bone video appendicular skeleton. So pectoral girdle is right up here, and the pelvic girdle is this area here. There's two clavicles, and it is connected to the sternum. The clavicles are connected to the sternum through the sternoclavicular joint, as well as it connects to the acromion through the acromioclavicular joint. The scapula is back here. The top of it is the coracoid process right in here. The subscapular fossa is right in here. So right in here. And then we have the glenoid cavity right in here. And then we also have the spine of the scapula. We have the acromion. We have the supraspinosus fossa. We have the infraspinosus fossa, which is further down. We have, again, the sternoclavicular up here and the acromioclavicular. Okay, next we're going to talk about the arm. Okay, we'll start with the top portion of the arm, and that is the humerus, which is this bone. The head of the humerus is right in there. The greater tubercle is right here, and the lesser tubercle is right here. The deltoid tuberosity is this area here. The medial epicondyle is here, and the lateral epicondyle is here. The coronoid fossa is right in here. Okay. And the coronoid process is what houses, it's what goes inside of there. The capitulum, it's this area here. And that articulates with the ulna and the radius. Okay. The trochlea is right in there as well. And that also articulates with the ulna and the radius. Finally, the olecranon fossa, which we need to turn this guy around to see, is this area here. And the ulna is what goes inside of there. Okay, next we're going to move on to the lower portion of the arm, which is the forearm. And the forearm is made of two bones. We'll talk about the first one, which is the ulna, this area here. The ulna has the olecranon, which is, I think it's easier to see this way, but it's this area that, let's see, right in here. That's the olecranon. The other thing it has is the coronoid process, and that's this area right in here. Okay, and then finally it has the styloid process, which is right down here. The other bone that we talked about is the radius, which is this, that also makes up the forearm. The radius has the head right on the top. And then it has the radial tuberosity, which is this little indentation here. And then it has the styloid process as well. And that's right down, right in here. You probably can't see where I'm pointing at, but it is. Sorry about that. Styloid process. Okay, next we're going to talk about the carpus. Sorry about that. And we're going to go over the bones. So here we go. So the proximal row has the scaphoid bone. It also has the lunate. It has the triquetral right in here. And it has the pisiform right in here. This is the pisiform. Then we have the trapezium. We have the trapezoid, we have the capitate, and the hamat. The bones are the proximal bones. They connect to the radius, and that's how they join the forearm. And then the trapezium connects to the pollex. So the metacarpals are from here and above, they end here. And then the rest of these are called phalanges. Okay, we're going to move on to the pelvic griddle. And here we have the coxal bones, which are these three. It's made of the ilium, the pubis bone, and the ischium right here. And the proximate borders are probably around here, where one bone ends and the other begins, and possibly around this area too. Alright, we're going to start with the acetabulum. I'm sorry for my pronunciation. It's right in here. The pubic symphysis is right in there. And then we have the obturator foramen is this area here. We have the iliac crest right up here. And then we have the anterior superior iliac spine, which is this area here. We also have the iliac fossa right in here. And then we have the greater sciatic notch. In order to see that, we gotta kind of turn sideways. So right in here, greater sciatic notch. We have the ischial spine, which is this little guy here. And then finally we have the ischial tuberosity, which is right in there. Okay, next we're going to move on to the tibia and the fibula. We'll start with the tibia. This is the tibia here. This is the tibial form. The medial and lateral condyles here's the medial, and then here's the lateral condyle right behind there. And then the tibial tuberosity is this area right in there. And then the medial malleus is right at the bottom, right in here for the tibia. And then the proximal and distal tibiofibular joints, also known as the superior tibiofibular joint, right in here where these two connect. And the inferior tibiofibular joint. Again, this is the distal tibiofibular joint and the proximal tibiofibular joint. Then we have the fibula, which is the second bone on the lower leg. The head of the fibula is right here, and then the lateral malleolus is right in here. Sorry, we also are going to talk about the femur, which is this long bone here. The head of the femur is right in there. That's the head. The greater truncator is right here, and then the lesser trochanter is right here. We also have the abductor tuberosity. It's right here. So we're looking at it from the back posteriorly. So here is the abductor tuberosity. The medial epicondyle is right in here. The lateral epicondyle is right in here. And then the medial and lateral condyles are right here. So this would be the medial condyle, this would be the lateral condyle. And then lastly we have the patella, which is this right here, the kneecap. Okay, lastly we're gonna focus in on the tarsus, or the foot. This is the talus right here, and it articulates with the tibia and the fibula, okay, superiorly, so from the front. Then we have the calcaneus. So if we turn it around, this is right here, the calcaneus. We have the cuboid is right here. The navicular is right here. And then we have the medial cuneiform right here. I'll show you this way. It's right in here. And then we have the intermediate cuneiform bone is here. And then lastly, the lateral one is here. Lateral cuneiform bone. The metatarsus they start here and they end right here. So all of these are metatarsus. And then the phalanges are all of this. So from midway, almost midway down, the tips or your toes are part of the phalanges. The hallux is the great big toe. That's what our hallux is.